Good afternoon and welcome to Bariatric Friday at UnitedTV. My name is Kemal Erkan. Many people hear terms like hernia repair, appendectomy, gallbladder removal, and colon surgery, but they really don't fully understand what these procedures involve and what's needed. The episode will provide viewers basic understanding of some of these most commonly performed general surgery conditions. And we are going to have our area of expert, Dr. Irgau, joining us as usual, and then we will try to address some of these and what you really need to know about this. We have done other episodes related to this topic, so they're in a playlist on our YouTube channel, so you can always get more information there, because we'll try to do it a little bit differently every time. So, Dr. Irgau, how are you doing?
I'm doing great. Happy to be here as usual, Kamal. Thank you.
So exciting topic,
Of
general
course.
surgery. So although it's general surgery, it's not that general, right? So it's for us, it's one thing, but for patients who are going through these, is something else. And we really don't know exactly what someone should be doing when they have these conditions. Some people may be able to delay some of these for different reasons, and I'm hoping that we can actually give some light into these questions. So now, what are some of the main factors determine whether surgery needs to happen immediately versus if it can wait from the patient perspective?
Sure. Essentially, whether something requires emergency surgery, that is, you don't wait, you have to go to the operating room to do the surgery, or whether you can do it in a planned fashion, which is called elective surgery, is determine really what are the dangers faced by the patient due to the problem they have at hand. Okay. An example, for instance, would be if they have like a hernia that is a bulge that they have noticed, but they don't have discomfort. It is something that they can push back very easily. That is something that can be taken care of in an elective fashion. The surgery will be planned at a future date. On the other hand, if the patient comes with severe pain and they have a bulge due to a hernia, but this hernia we cannot push it back, and we're suspecting that there is intestine caught inside and twisted that is going to be deprived of blood supply, and that piece of intestine may die, and that can cause a much bigger problem and complication, then we have to go ahead and fix the hernia immediately. Another example would be, for instance, appendicitis. Appendicitis is something that occurs when the appendix is inflamed, and this can progress into what's called ruptured appendicitis, where the appendix bursts and infection and bacteria spread inside the abdominal cavity, and that can lead to a much more serious problem, which is sepsis.
Someone can die from it.
Someone can die, and people have died. Before modern medicine has been established, people used to die because of appendicitis that was not treated in a timely fashion. So when there is immediate danger to the life of the patient, we have to proceed. So if there is a danger that there may be uncontrolled bleeding because of a condition, if there is danger that there may be a rupture of an organ leading to sepsis, there is danger that there may be widespread infection because of an inflammation in the abdomen, then we have to act. Essentially, that's how we look at it. And an example essentially could be like if you're near a house and you have a gas leak, you don't wait. You call, the service immediately, because something bad could happen. If you have a burst pipe and there is water, then you have a few hours maybe to wait until they come and fix it. On the other
It's
hand,
kind of like a gas leak versus like a water leak, but I'll give you like a very quick example. So if you live in the city, water is so expensive. So I didn't realize how expensive it was until this was, I think, 2 years ago. I received a water bill that was like 10 times more than what I normally would get. It was coming from a small leak.
So if you have a few hours anyway to fix it. But on the other hand, if you have an old roof that is leaking every time it rains, you don't have to fix it immediately. You can wait some time until you get a contractor and some estimate and stuff to fix it. So there are certain things that require immediate attention and other things that can be planned for a later date, essentially.
So one of the things that we hear about deciding on the surgeries oh, I'm too young or I'm too old. And sometimes I ask you these questions in our case conferences. Well, does this patient really need this? And then you're like, well, that's a clinical issue, and this is what it is. So, how does a patient's age influence surgical decision making?
Really, more than age, we look at the overall health of the person, right? So we look at the person's overall health in terms of chronic illnesses they may have, whether they have heart disease, lung disease, that are the organs that are going to be affected by anesthesia. And that sometimes, you may find somebody who is relatively on the older side, but very healthy and will withstand the operation without any problem. Even somebody younger than that could be a person with medical problems that may not tolerate the surgery as well. So we're looking really at the health of the person more than the age of the person. And that is obviously looking at how they will stand the operation, because remember, surgery is a stressful event to the body, to the physiology. It's a stress to the heart. It's a stress to the system. The lungs will be taken on by a machine that will be breathing for that person for a while, and recovering from that requires a certain reserve, right? And all that obviously can depreciate over time, as we age. But again, it depends on how well that person has maintained their health. So and then the other side of the equation will be how well will they recover from the surgery. And from that respect, we look at something called frailty. If somebody falls on the ground, how are they able to get up and go, right? So you can have somebody who may be 80 years old who may fall and then get up by themselves, and then maybe somebody who's 60 years old who may not be able to do that because they are more frail. They haven't got a body that is resilient, essentially. So frailty is also a very important factor for us, because it tells us how well that person will recover from surgery, or how long it will take them to recover. And then how independent is that person is important also, right?
Right.
Because that will determine whether right after surgery they will be able to go home, or they need some kind of sheltered environment to recover. All those factors are important, but they're not strictly age related. And again, talking about analogy, you could have a classy old car that's been well maintained. That would be fine for a long trip, compared to a relatively new car that has never been well maintained, that may break down
Right.
in the
True.
course, right?
True.
So it really has to do with the physiological age as opposed to the chronological age.
But there are, people who are we are surrounded by people who are always opinionated, so they all have different ideas on what you should be doing, and the best, and why we do this with licensed physicians is because I cannot make that decision for you. I mean, I think these days they use my doctor's title, but I'm not a medical doctor.
Mm-hmm.
So you are. So you can make that decision.
Right,
So
right.
if your friends are medical doctors, you can listen to them. But if they're not, you really need to listen to either our show or your doctor.
Mm-hmm.
Now, in terms of symptoms and what actually prompts, so what are the main issues, main symptoms that people should be watching so that they can actually look for help?
So generally, when there is, for instance, an abdominal problem, an abdominal complaint, like pain in the abdomen that doesn't want to go away, or even worse, it gets worse over time, and really it's taking your attention. You cannot go to sleep, you cannot do very much. That is something
Hmm.
really that shouldn't be ignored. Of course, if you have persistent nausea and vomiting, if you see any blood in the vomits, if you see any blood in the bowel movement, all these are very potential signs of a serious problem that cannot be ignored. Of course, if you're having pain, fever and chills at the same time with that, that also can indicate that there may be sepsis going on. If you touch your belly and it's very painful to touch, that's called tenderness. And when you touch your belly, it's not soft, it's very hard as well as painful. That's really an indication that there may be something serious going on. So yes, we can have transient problems sometimes, a virus infection or something like that, that we can sit and see how it goes. But when things persist, our body is trying to tell us something, and we cannot no longer ignore it.
True. And so this is kind of like, while I was listening, one of the things that is important, I know people casually take a lot of painkillers. Some of them are over the counter, but they just take them on a daily basis. So some of these can overshadow uh, the 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 process of you realizing that you really have a bad pain. So if you are just doing all these on your own at home, and when I say this, like we are all guilty of this, but the main thing is how long it's been happening. So how bad it is. So you can't just overcome the pain with pain medication. So because those can delay the decision making,
Absolutely.
and then all of a sudden you have a bigger problem.
Yep.
So one of the issues that we know is the uh, inflammation where the body is already just really trying to tell us something. So why is this dangerous if it's not treated?
Absolutely. So, inflammation essentially is actually our body's response to an infection, to the presence of a foreign body, to a situation where there is loss of blood supply, for instance. All those will lead our body to respond in a certain way. And that's what inflammation is, in a way. And the body is trying to, keep that problem in a isolated way. So, for instance, if there is inflammation of the appendix, that's appendicitis, there is a series of things that happen in our body which will try to localize that problem, keep it in that corner rather than spread, right? But there is a limit to how far that can go. The problem itself can really overwhelm the body's attempt to limit that, and then the problem can spread. So, for instance, if you have appendicitis, and if we let it continue, then the appendix can burst. Well, what happens then? Well, it means that bacteria that are within the intestine and they're supposed to stay there, then get out into what's called the peritoneal cavity. This is supposed to be completely sterile. Now it's invaded by bacteria. But the problem also is that this cavity itself is lined by a structure that has good blood supply, that absorbs things very quickly, and it will spread it around the body very quickly. So a problem, an infection that was localized in a corner of your abdomen now takes on the whole body. In that case, there is a much bigger inflammatory response. The blood vessels become leaky. Your blood pressure starts to go down. Blood supply to essential organs like your brain, your heart, your kidney start to go down, and those organs start to fail. And if the failure goes beyond a certain point, the situation may not be salvageable. The person may die, right? So containing inflammation is critically important. Letting the inflammation go out of control, it's a terrible problem. An analogy, again, if we are to have analogy in our session today, is to talk about a kitchen fire, for instance. A kitchen fire, when it starts and you control it immediately, you've solved the problem. If you don't, what happens? It spreads and it can take on the whole house and worse.
Right.
So controlling inflammation whilst it is localized is very important. If it spreads, it leads to much bigger problems that can lead to disability, organ failure, or even death.
And that's probably why some of these are, especially the appendix and gallbladder, ends up in the emergency room,
Absolutely.
and then they become more serious.
Absolutely. Either one of these problems can actually take on that course, or a hernia that is not treated and becomes strangulated, where a piece of intestine is caught there, it dies. The bacteria in the intestine get out and spread throughout the body. That's another type of uncontrolled inflammation. So those problems that can be taken care of relatively safely because they are localized, once they spread, they become a much bigger problem.
So maybe this would be the time for me to ask the the main differences between emergency surgery and the from the complication standpoint and the planned surgery, elective surgery. So from the surgeon standpoint, what like the same procedure done, one in the emergency setting, the other one is time that we schedule, patient shows up, they prep. So in terms of complication, can you just explain that?
Absolutely. There is no question that when surgery is done in an urgent fashion, in an emergency fashion, the potential for complication increases, and this is well documented. And why is that? Well, first of all, the nature of the problem itself. If you are going after a problem that requires emergency, it means it's a big problem to begin with. It's a serious problem, right? So it means the patient will suffer a bigger consequence if you don't take care of it. Whereas if it's being done in a planned fashion, it means it's not as serious of a problem and you have time to get it. So the issue itself obviously determines whether it's a condition that has more consequences or not, right? The second thing is the patients themselves, when they come for emergency surgery, they come in a disadvantage because they are likely to feel weaker. Maybe they haven't eaten for a while because they have been sick. Maybe they haven't been drinking for a while because they feel sick. So they are dehydrated. So their body is overall at a much weaker position than in an elective setting. So you have a patient who is sicker and they have a bigger problem. And then you're doing surgery in an unplanned situation, which could be 2 o'clock in the morning. Well, guess what? At 2 o'clock in the morning, the hospital, no matter how well you think it will be at their best, they're not at their best. You don't have the staff, you don't have the equipment, you don't have the processes that are working in a planned fashion, which is where elective surgery is done, right? So yes, when there is an emergency, we have to take care of it, and we have the capability of taking care of it, but it's not an ideal situation, right? So again, imagine another analogy would be if you are flying out of Philadelphia, on a planned flight from Philly, I don't know, to Miami. There is a schedule, there is a team, everything is well processed. But if they have to arrange a flight for you in a hurry because there is an emergency, there is not much time to do all those things that are normally done. So the risks get up a little bit more. Maybe even if the weather is not that great, you will take risks and go because there is an emergency. There is a need to go, right? So emergency surgery should be done only when it's necessary. In all situations, you try to avoid it. In other words, if there is a condition that you can fix in an elective fashion, it's best to do it in that way. And that's the very important conversation, for instance, when patients come with a hernia, for instance, right? They have a hernia and they say, I'm not going to have it fixed now. Yes, okay, you can wait. But it is possible that that can cause that can become a condition that requires emergency surgery, and then emergency surgery is never ideal.
Now, can hernia just disappear on its own?
No. No. A hernia is the result of a hole in the muscle, right? And that hole will not go away. So it has to be fixed. Now, it may not give problems. Yes, it's possible that a person may die for other causes with the hernia and go to their creator with the hernia, but it also may become a problem. And it may become a problem when you're much older, much sicker, when surgery is more dangerous for you. So having things fixed earlier makes sense, essentially.
So now one of the important thing actually with the surgery is, it's one thing that you have the surgery, but it's maybe equally important is what we do after the surgery and then how we take care of ourselves. Now, the recovery protocols are important, and can we talk about how actually recovery protocol improve the outcome and the complications?
Sure. So obviously the surgeries that we do nowadays have improved dramatically in terms of how they're done and the processes they are used to recover the patient. For instance, surgeries we used to do in the abdomen required a bigger incision. When I was going to medical school, most of the surgeries were done in an open fashion, right? The first small incision I saw was actually, I was a third-year medical student, right? And that was a rarity at that time. So when we did gallbladder surgery, we made a big incision on the right side of the upper abdomen, and then the surgeon would put their hands inside the abdomen and they would get the gallbladder, cut the appropriate fractures and take it out. So the person will be left with a big incision, but that incision is through the muscle as well. And all that has to heal. That required a long recovery time. Similarly, for many other procedures we were done in the abdomen, we used big incisions, big midline incision that was a cut from the breastbone all the way down to the below the belly button. Those were common incisions for surgeons to make. Now we can do those same surgeries with tiny little incisions, which means that the person recovers much better. On top of that, we've improved anesthesia greatly, for instance, right now. The recovery from anesthesia is much better because of the types of medications that we are able to see. They don't linger in our head as long, so our head is much clearer, sooner after the surgery than before. Another improvement is the pain medications we use. Until very few years ago, we used very powerful narcotic medications to control pain. And that meant that we had to also suffer the consequences of those narcotic medications, which meant our head would not clear very quickly, our intestine would not recover its function very quickly. So our recovery was really slowed down because of that. Now we have something called ERAS protocol, which is enhanced recovery after surgery, which is a series of measures that we take even before starting the actual surgery, which will prepare the patient to recover faster. And this is very important for our practice. For instance, Kamal, as you know, most of our surgeries are done in an outpatient setting right now. Very few people have to stay overnight, which means that we are using methods really that allows us to recover the patient pretty much within a few hours after surgery for them to go home and recover at home.
That's the first 1 hour, and the second hour are already the most important part. So we want to make sure that when they go home, they follow the instructions, and it's really amazing. Like if you were to ask me 10 years ago when we took over the surgery center, American Surgery Center, so I mean, that time I thought I had enough experience on the surgical side with running the surgeons for emergency care for several years for 3 different hospitals, location wise, and being part of CRIAS and other surgical offices. And I just realized that I didn't know much, because one of the things that being able to send patients home and why they actually recover better at home, why, unless you have to, why the hospitals are not best places to just roam around. Like, you need to be in a setting where you are comfortable. And while you are doing that, we want to make sure that you are taking care of yourself and following the instructions.
Absolutely.
So not just the general surgery, but even for bariatric surgeries, we have 99.9%
discharge,
discharging patients on the same day. Now, in terms of preparation, if we can talk about a little bit of the physical and the psychological preparation, what should the patient be doing before the surgery?
Definitely, if they are a smoker, stopping smoking is very important. And we've talked in our sessions how smoking can actually lead to more complications after anesthesia and after surgery. So stopping smoking, if they are a smoker, is very important. Enhance their nutrition, make sure that they have good nutrition in terms of healthy nutrition. If they have diabetes, make sure the blood sugar is well controlled. If they have high blood pressure, make sure that they're taking their medications and control the blood pressure. If their weight is on the higher side, try to get down. It's surprising how much improvement the surgery will have just by dropping a few BMI points before the surgery. Just the surgery itself becomes much less challenging for the surgeon when the person is not highly overweight. And also, the body itself is much more resilient to complications when the weight is on the lower side as opposed to the higher side. And then, of course, being active so that they can be active after the surgery as well. Ask questions about their recovery so that they would follow the instructions properly when they're given, and also make sure that they follow the instructions as well. The instructions are there for a purpose, and it's important to follow them for a healthy recovery.
So one of the things that we need to make sure that patients are watching, and then the caretakers, they're watching the patients very closely, because we want to make sure that patients are not ending up in the hospital after the surgery. What are the things that we can do to prevent that?
Well, essentially, again, it's about preparing the patients, right? We talked about the things that they could do beforehand for them to stay healthy, but afterwards, make sure they stay well hydrated, make sure that they walk frequently. And this issue of walking is actually required a culture shift, you know. You may not remember because you're too young, but there were times when people would have hernia surgery and they would be in hospital for days. And most of the time when they were in hospital, they would be lying in bed, essentially, right? And the chances for having blood clots, for having pneumonia and other things just skyrocketed, right? So people thought that just because they had surgery, the default position was to lie flat on the bed most of the time. And then you have relatives coming to see you, standing above you, and you're lying there, you know, playing the role of the sick person, and the sick person obviously has to be in bed. That was the classic picture, right? Well, not with modern surgery. With modern surgery, we want people to be active. Active meaning up and about, right? So what I tell patients is, yes, if you're tired, if you need to sleep, use the bed. But otherwise, your default position is actually walking, which means that they could be sitting at home, watching TV, reading a book, but then every 15, every 20, every 30 minutes, they would get up and walk around. And that is critically important because, first of all, it minimizes one of the potentially serious complications after surgery, which is blood clot formation, right? If you walk, you minimize that complication greatly. Secondly, if you're walking and using your lungs to breathe adequately, you actually minimize the chance for pneumonia or potential respiratory problems. The other thing that is also that I find very important is the psychological aspect of it. If we are up in a vertical position, we're telling our brain we're not sick anymore. We are ready to walk. On the other hand, if we're lying in bed with everybody coming, presenting us with goods because we're sick, presenting us with comforting thoughts, then our brain is going to say, oh, okay, I'm here, I cannot do anything. Right. It's going to take me a while to recover. And unconsciously, it takes you a long time to recover. So that shift is very important. So we want people to really get up and walk. Of course, if there is discomfort, they need to take their medication for discomfort. But also, the other thing to understand is that if you've had surgery, we're not looking for zero pain. That's just not realistic, right? Some discomfort is possible, obviously tolerable, and that can vary from person to person, but don't expect zero pain. But we don't want a pain that is rated as 5 out of 10 or 6 out of 10 or 7 out of 10. We want it to come down to the 1 to the 2 range, right? But you know, you don't want to work towards zero pain. That's not really realistic. And preparing patients for that actually is also very important, because when they expect it, then their recovery is that much faster as well.
Right. So my last question for this topic is the healthy habits and characteristics that contribute for the best surgical recoveries. We mentioned some of them.
Yes.
But anything that you would like to add?
I think essentially is the healthier you are as you approach surgery, the better things are. And it doesn't mean that you should be free of some illnesses. You could have diabetes. You could have high blood pressure. You could have sleep apnea. Okay, it doesn't mean you cannot have surgery because of that. But what it means is get a good grip on the control of these conditions. For instance, if you have type 2 diabetes, and your blood sugar is on the higher side, make sure you talk to your doctor so there is better control of that blood sugar. If you have high blood pressure and your doctor prescribed medication, don't take the medication only when you remember. Make sure you have a disciplined approach and you take your medication on a regular fashion, and take your blood pressure at home you yourself so that the range is within the accepted parameters. So well-controlled blood pressure, well-controlled blood sugar are important. If you have sleep apnea and you have a CPAP machine, use it. It's going to be important for your recovery after surgery, because some of the medication that may be given at the time of anesthesia may actually make it much more dangerous if you have sleep apnea that's not treated. So the treatment has to continue. So staying well hydrated, well nourished, and also importantly, engaged in your recovery. In other words, ask questions about your condition. Ask questions about what you could do to enhance your recovery. Have that conversation with your doctor. Follow instructions. And honor follow-up appointments as well. So if there is a follow-up appointment that has been placed, come so that your doctor will be able to check that your recovery is on time and there are no potential for complications.
And the prevention kind of is everything in any of the health-related issues. So, and then our body is telling us, giving us messages and signals, and we need to really watch that.
Absolutely.
So, and we really don't need to look for answers in on the internet or even the AI. Well, you can use them, but not all of them are the same. So medical professions are the best, and if you believe you have surgical emergencies or surgical need, it's just one phone call you just need to make and come and see. And if you really want to make that decision, I think you want to watch this episode again to make sure that you know that you shouldn't be delaying the procedure. So that's kind of our general surgery session. So now the fun part, whenever Ethan is ready, we have the Rated with Dr. Ergal.
All right.
And this was Ethan's idea, right? Rated with Dr. Ergal. And this is the fast food options. Now, I'll just give you guys one very quick, like I share everything, so then people know what's happening in our lives. So, every time I eat fast food, and I do eat, I'm not lying about it, so like I'm open. Wednesday when we have the partners meeting, so I don't know if you felt anything, but just like I had late lunch from McDonald's.
All right.
And every time this happens, every time my body just acts differently. It's not happy. It's not happy. And it was with me until like 8, 9 in the evening. So and sometimes you do this knowingly, and I need to work on that psychology of this problem. So the fast food is bad, period. But we want to at least, that sometimes life is about making practical decisions. So we want to give you some healthy options, and we are going to rate that with Dr. Ergal.
Yeah, I was going to say, I think whoever created this list is telling us fast food does not always mean unhealthy, right?
So, well, I didn't make the list, obviously. So I think Faith did it. So let's start with the Chick-fil-A spicy Southwest salad.
That's a good one. 8 out of 10. It's mixed greens topped with spicy grilled chicken, vegetable, cheese, tortilla, and creamy salsa dressing. And why is it high rated? Because it has plenty of protein, obviously. It has vegetables and fiber. Although we have to be careful with the dressing and the tortilla that are adding significant calories. So for our bariatric patients, I still think it's a very good choice if they could use half of the dressing and limit their tortilla.
I never had anything from this next one. Panda Express broccoli beef with steamed brown rice ice.
7 out of 10. It is really tender beef and broccoli in savory ginger soy sauce served in brown rice. It has good protein and vegetables, but the rice can quickly increase the carbohydrate intake. For our bariatric patients, I would say it's a good choice.
So Wendy's grilled chicken wrap duo.
I would say 7 out of 10. Grilled chicken, lettuce, cheese and sauce wrapped in a flour tortilla. So excellent protein, but much of the carbohydrate comes from the tortilla, and that's where we have to be careful. So I would say good for our bariatric patients. One wrap is usually sufficient. Remove the part of the tortilla if possible.
So that's about 840 calories.
Yeah.
And don't eat.
One meal.
Taco Bell. This is Taco Bell's chicken bowl.
I would say 8 out of 10 again. I think whoever made this list is choosing really some
I think you're
good
just being
options.
very generous today. Like,
Grilled chicken with rice, black beans, lettuce, cabbage, pico de gallo, and cheese and sauce. I would say it's a well-balanced meal with protein, vegetables, and fiber that can be easily customized. For our pediatric patients, it's a very good choice. No question.
so I don't know what this next one is. Again, never tried Jimmy John's totally tuna sandwich.
Sandwich rather than sandwich.
Okay.
It's essentially tuna salad wrapped in a lettuce instead of bread. Very low in carbohydrates. It's a very good source of protein.
It's going to get 8 or 9 now. Like,
It's an 8 out of 10. Though the mayonnaise can add calories. I think for our bariatric patients, it's a very good choice. A smart bread-free option. Obviously, they have to watch the portion size because the mayonnaise can add up.
so, Ethan, what's the next one?
This one, the Chipotle adobo chicken burrito bowl.
Adobo, like a PDF chicken?
Adobo chicken.
Okay.
The flavor, yeah.
Chipotle
Seasoning?
adobo chicken burrito bowl.
Good one. 9 out of 10.
Dr. Gad, like, what happened today?
It's grilled chicken, served with customized rice,
Like, are you
beans,
guys doing really
vegetables,
good in
salsa.
like the soccer or something? Like,
No, you're giving me all the good ones from the fast food
I was
restaurant.
gonna say I'm very healthy if this is the case.
Yeah, outstanding protein and one of the most customizable fast food meals. Excellent for our post-bariatric patients. They just need to be a little bit on the light on the rice and skip this sour cream and the queso.
so Popeyes black-ended chicken tenders with green beans.
10 out of 10. It's a
All right,
non-breaded
it's
seasoned
official.
chicken.
Dr. Irgau is
Tenders served with green beans. It's
influenced
extremely
by
extremely high protein, very low carbohydrate, and no breading. For our bariatric patients, it's an outstanding choice. One of the
so
healthiest fast
blackened
foods.
chicken. Like, what's blackened chicken? Like the non-bread? Okay, so no bread.
Yeah. So instead of having breadcrumbs when they fry it, there is no breadcrumbs.
Like
It's just-
grilled chicken.
Yeah.
So
Exactly.
Popeye. Do we have Popeyes here?
Yes, we do have Popeyes.
Okay. Hey,
It's a good thing he
Next
doesn't know
one is
Popeyes,
mine.
right?
Yeah, there's a few locations for people to choose from.
the only thing that I would never eat at McDonald's, I'm sure it's gonna get.
Wasn't there a rush to go to Popeyes to buy something a while back,
Yep,
where people were fighting to get in, right?
Yeah, I was actually one of those people.
Oh, were you?
And it was very hard to find the Popeyes chicken sandwiches.
Why do you need to find one?
So because they said it was better than Chick-fil-A, and I had to test it. You know, it's a big deal.
Okay, this is the next one is the thing that I will never eat at McDonald's. McDonald's filet of fish.
5 out of 10. And it's really breaded fish fillet with tartar sauce and cheese on a steamed bun. Provides some protein because of the fish, but it's fried and relatively low, really, in protein overall. Lots of calories instead. For our bariatric patients, I would say moderate. Remove most of the bun and limit the tartar sauce.
So I think I realized, I think what Faith did, she picked the healthiest ones already.
Yeah.
Yeah, that was kind
Like,
of yeah.
why would we rate the healthiest ones? We want to rate like one good, one bad one from the same place.
To show them.
Like, I want to see where number
You want the number
McDonald's
one?
number 3 with milkshake is.
You want the Big Mac?
Right.
The double cheeseburger?
So, like next one, like these. Okay, so glad that I am not gonna eat anything right now. So, Wawa teriyaki roasted chicken salad
8 out of 10.
and get a lot of affection.
Mixed green topped with roasted chicken, vegetables, and teriyaki sauce. High in protein and vegetable rich. Teriyaki sauce can contribute to the sugar, obviously. It's good for our patients. I would say go very light on the sauce and
All
eat the
right.
protein first.
Ready for the last one. I think the last one is going to get a high number. Chili's gutless sirloin.
9 out of 10.
Yeah. Because there's
It's
nothing to eat here.
grilled,
Just the
lean
meat.
sirloin steak served with vegetables from Chili's lighter menu. Excellent protein, obviously, excellent protein to calorie ratio. Minimal refined carbohydrates. For our bariatric patients, I would say it's an excellent choice. Probably one of the best sit-down restaurant choices for our bariatric patients.
That's what I do weekdays.
Yeah,
that's so
good
like,
one, yeah.
and that's probably one of the things that when you eat these crazy stuff, it's just crazy, like really.
So we probably had a very high rating just from this because they've chosen
Like
all the healthiest
number
options.
number 3 on McDonald's is about 1,500 calories.
Oh, is that right? Wow.
Yeah, without the milkshake. So, all right. Well, this was again, we already selected the healthiest ones without asking Dr. Erkan. So this was kind of like a cheated list. So I want to make sure that we give them bad options and then get like low rates as well. But that's why like I don't want people to compare this with our other episodes and I say, no, fast food is healthy. That's not the message.
No, but you're trying to be realistic. In other words, you cannot stop people from going to fast food restaurants. So if they go, we're saying to them, you do have healthy choices there as well.
Well, of
I
course
mean,
you can,
relatively
like,
healthier.
You can't stop me. Like,
Right, exactly.
How can I tell
if
people
I
that
cannot stop Dr. Kamal, then we're not going to stop anybody else.
So, well, this is end of our episode for today. This was fun and a lot of education as usual. And Dr. Ria, thank you,
of course,
for being with us. And we are hoping that our audience are finding these beneficials and some fun, of course. We'll be back next week. It's going to be a premiere because it's the 4th of July weekend. So we are off on Friday, but there will be a recorded episode. And then we'll be back for live events on July 10th.
Yep.
Well, until then, happy 4th next weekend. And we'll see you soon. Until the next time, stay united. Bye-bye.